What local anesthetics are currently available in North America? At present, there are 5 drugs available. These are articaine, bupivacaine, lidocaine, bupivacaine, and prilocaine. What are the expected durations of anesthesia with these drugs? We can divide these anesthetic drugs into 3 categories based upon the expected duration of pulpal anesthesia. 3 categories are short-acting drugs, providing anesthesia lasting for approximately 30 minutes, intermediate-acting drugs, providing anesthesia lasting up to 1 hour, and long-acting drugs, providing pulpal anesthesia lasting 90 minutes or longer. According to the ADA Survey of Dental Practice in 1999, the typical treatment time for a general dentistry patient is 47 minutes. Treatment time for a specialist patient is 39 minutes. Short-acting local anesthetics provide pulpal anesthesia lasting for approximately 30 minutes. The one drug in this category is bupivacaine 3%. This drug provides pulpal anesthesia lasting from between 20 to 40 minutes and soft tissue anesthesia lasting anywhere from 2 to 3 hours. Long-acting local anesthetics are drugs which provide pulpal anesthesia lasting from 90 minutes up to 3 hours, and soft tissue anesthesia lasting anywhere from 3 hours as long as 12 hours. The one drug in this category today is bupivacaine 0.5% with epinephrine in a 1 to 200,000 concentration. Bupivacaine has a slow onset of anesthesia, approximately 6 to 10 minutes, but provides pulpal anesthesia lasting up to 3 hours and soft tissue anesthesia lasting as long as 12 hours. It is commonly used as a post-surgical pain control medication. Intermediate-acting local anesthetics provide pulpal anesthesia lasting for approximately 60 minutes, and usually soft tissue anesthesia lasting from 3 to 5 hours. In this category, we have articaine. Articaine is a 4% local anesthetic containing epinephrine in either a 1 to 100 or 1 in 200,000 concentration. The 1 to 100,000 concentration is available both in Canada and the United States. At this time, articaine in a 1 in 200,000 concentration is not available in the United States. Articaine has an onset of anesthesia of approximately 2 to 3 minutes and a duration of pulpal anesthesia lasting for approximately 1 hour, soft tissue anesthesia for approximately 3 to 5 hours. Lidocaine is available as a 2% concentration with epinephrine in a 1 in 50,000 or 1 in 100,000 concentration. Its onset of anesthesia is 3 to 5 minutes with a duration of pulpal anesthesia of 1 hour and soft tissue anesthesia lasting from 3 to 5 hours. Bupivacaine 2% with levonorepinephrine in a 1 in 20,000 concentration has an onset of anesthesia of approximately 3 to 5 minutes with a duration of pulpal anesthesia lasting for 1 hour with soft tissue anesthesia for approximately 3 to 5 hours. With epinephrine, prilocaine provides pulpal anesthesia within 3 to 5 minutes with a duration of approximately 60 to 90 minutes and soft tissue anesthesia lasting anywhere from 3 to 8 hours. Prilocaine plain is interesting. If administered by nerve block, prilocaine plain provides pulpal anesthesia lasting anywhere from 40 minutes to 1 hour. However, if you infiltrate with prilocaine plain, pulpal anesthesia lasts only 10 to 15 minutes. Why don't patients always demonstrate the expected duration of anesthesia from these drugs? Many factors work to modify patient response to medications, including normal variation from patient to patient, the accuracy of our injection technique, status of the tissue at the injection site, anatomical variation, and the type of injection administered. One factor is the normal variation in response to drugs from patient to patient. This is called the normal distribution curve or the bell-shaped curve. The bell-shaped curve illustrates that 70% of patients respond to a drug appropriately. For example, with lidocaine with epinephrine, 70 out of 100 patients will have pulpal anesthesia lasting for approximately 1 hour. 15% of the population are hyper-responders to a drug. With lidocaine with epinephrine, the duration of pulpal anesthesia for these patients will be in excess of 1 hour. It might be an hour and 15 minutes, it might even be an hour and 30 minutes. The last 15% are hypo-responders, persons in whom the average dose of a drug does not provide the desired clinical effect. For lidocaine with epinephrine, these patients may have pulpal anesthesia lasting for only 45 minutes, 30 minutes, or in some cases as short as 15 minutes. This is normal and to be expected whenever drugs are administered. What are the maximum recommended dosages of local anesthetics? MRDs for the commonly used local anesthetics in dentistry are calculated as milligrams per pound or milligrams per kilogram of body weight, up to an absolute maximum dosage. Other factors which might modify the MRD include the duration of time over which the drug is to be administered and the physical status of the patient. What factors are considered when selecting a local anesthetic for use in a dental patient? The primary factor is the expected duration of the planned dental treatment.
Every appointment will be no longer than 30 minutes. Okay?
Great.
Then you can go back to business. All right?
Once the drug is selected, then we have to consider if there are any medical contraindications to the use of this drug. The third factor is the need for hemostasis. Are we doing a procedure in which bleeding is going to be significant? If it is, then a vasoconstrictor like epinephrine must be included in the anesthetic drug.
Tell me, Clint, do you bleed easily?
Well, I do get a lot of bruises.
You get a lot of bruises.
Yeah.
Okay.